Good afternoon. My name is Nathaniel, and today's case study is about type 2 diabetes. Some of the causes of type 2 diabetes is insulin resistance. Insulin resistance occurs when the cells in the muscles, fat, and liver do not respond as they should to glucose. Insulin is a hormone made in the pancreas that is essential for regulating blood glucose levels in the body. When glucose enters the cells and the levels in the bloodstream decrease, a signal is sent to your pancreas to stop producing insulin. Due to the muscles, fat, and liver cells being unable to use glucose well, the pancreas begins to make more insulin. Due to this higher demand, the pancreas is unable to keep up. This causes hyperglycemia. Hyperglycemia means increased glucose in the blood. A fasting blood glucose of above 125 milligrams per deciliter and 2 hours after a meal, which is postprandial, the glucose is usually above 180 milligrams per deciliter. Another cause is family history. Unfortunately, some ethnicities make patients more likely to develop type 2 diabetes. These ethnicities include African Americans, Alaska Natives, American Indians, Asian Americans, Hispanic Latinos, Native Hawaiians, and Pacific Islanders. Um, More causes of type 2 diabetes is obesity. A patient has an increased chance of developing diabetes if they are not physically active and obese. This lifestyle is modifiable and can help with decreasing the chance of developing type 2 diabetes. Extra belly fat is linked to insulin resistance. As stated in slide 2, insulin resistance causes the pancreas to overwork due to increased demand for insulin. Eventually, the pancreas will be unable to keep up with, which in turn increases glucose levels. Genes can also increase a patient's tendency to be overweight or obese. Symptoms of type 2 diabetes tend to happen over time. These symptoms include polydipsia, which is increased thirst, polyuria, which is increased urination, increased hunger, fatigue, slower healing of cuts, neuropathy. Neuropathy is tingling or numbness in your hands and feet, blurred vision, unexplained weight loss, frequent vaginal yeast infections, and urinary tract infections. Based on my experience working in an endocrine office, metformin is usually the first medication prescribed for newly diagnosed type 2 diabetics. It works by lowering the amount of glucose your body makes and absorbs. On average, metformin can lower a patient's A1C by 1.5%. The most common side effect of metformin is diarrhea and nausea. I encourage patients to take it with a meal or immediately after a meal. Other side effects include a metallic taste in the mouth, gas, and headache. Some contraindications to metformin would be type 1 diabetes, anemia, dehydration, kidney disease, liver disease, pregnancy, and an allergy to metformin. Sulfonylureas help the pancreas release more insulin. The release of more insulin decreases blood glucose. Some commonly used sulfonylureas include glipizide, glyburide, and glimepiride. Side effects include increased risk of hypoglycemia, hunger, weight gain, upset stomach, and heartburn. Contraindications for sulfonylureas are type 1 diabetes, an allergy to sulfonylureas, kidney disease, liver disease, and patients with ketoacidosis. DPP-4 inhibitors, also called gliptins, prevent the breakdown of GLP-1 so it stays longer in the body. And GLP-1 is a gut hormone that triggers insulin release, blocks insulin production in the liver, and helps you feel full. Some common DPP-4 inhibitors are Januvia, Tradjenta, Nesina, and Onglyza. Side effects of DPP-4 inhibitors are diarrhea, nausea, stomach pain, headache, runny nose, sore throats, and increased risk of pancreatitis. Contraindications for gliptins are also type 1 diabetes, a history of pancreatitis, and diabetic ketoacidosis. Injectable insulin. Insulin helps control blood glucose levels in people who do not produce enough insulin. Insulin directly lowers glucose levels by increasing uptake into muscle and fatty tissue and reducing release of glucose from the liver. Insulin is injected in the abdomen, legs, back of arms, and buttock. Side effects for insulin are hypoglycemia, which is low blood glucose, skin reactions at the injection site, weight gain, and the development of insulin antibodies. A contraindication to injectable insulin is hypersensitivity to insulin. There are different types of insulin. Rapid acting begins to work within 5 to 20 minutes and will continue to work for 3 to 5 hours. Rapid acting insulins include Humalog, Novolog, Fiasp, Lyumjev, and Apidra. Regular insulin, which is short acting, begins to work 30 to 45 minutes after injecting and will continue working for 5 to 8 hours. Regular insulins include Novolin R and Humulin. Long acting insulin takes about an hour to work and will last up to 24 hours. Long-acting insulins include Lantus, Basaglar, Levemir, and Toujeo. Ultra-long-acting insulin takes about 6 hours to start working and can last up to 48 hours. These insulins include Tresiba. GLP-1 agonist. GLP-1 agonists are medications that help lower blood glucose levels and promote weight loss. Trulicity, Mounjaro, Ozempic, and Rybelsus are a couple of the GLP-1s being prescribed today. Side effects include loss of appetite, nausea, vomiting, diarrhea, dizziness, tachycardia, hypoglycemia, thyroid cancer, and headaches. Contraindications include type 1 diabetes, pregnancy, a history of pancreatitis, and a family history of medullary thyroid cancer. GLP-1 agonists like Ozempic and Mounjaro are currently being used by people who do not have diabetes due to the decreased appetite side effect. This in turn will cause weight loss. Comorbidities: chronic kidney disease. Elevated blood glucose can damage blood vessels in the kidneys as well as the nephrons. This causes them not to work as well as they should. Many patients don't realize they have chronic kidney disease until it's advanced and they need dialysis. Kidney function is checked through blood work to see how the kidneys are filtering and urine to see if there is protein in the urine. The presence of protein in the kidneys indicates damage due to elevated blood glucose. Approximately 1 in 3 adults with diabetes has chronic kidney disease. Another comorbidity is heart disease. High blood pressure can damage the blood vessels and nerves that control the heart. Over time, this damage can lead to heart disease. Other risk factors that increase development of heart disease in diabetics are smoking, high blood pressure, abnormal cholesterol levels, obesity, chronic kidney disease, and a family history of heart disease. Diabetic retinopathy. Diabetic retinopathy is an eye disease that affects the retina. Elevated blood glucose damages the blood vessels in the retina. These blood vessels swell and leak. Sometimes abnormal, new blood vessels grow on the retina. These changes can steal a patient's vision. There are 2 stages of diabetic retinopathy: non-proliferative diabetic retinopathy, proliferative diabetic retinopathy. Diabetic retinopathy continued. A non-proliferative diabetic retinopathy is an early stage. Um, Tiny vessels leak, making the retina swell. When the macula swells, this is also called macular edema, it causes vision loss. Proliferative diabetic retinopathy is an advanced stage. New vessels, also called neovascularization, starts to grow and bleed into the vitreous due to swelling. These new vessels form scar tissue and can lead to a detached retina. Patient education. Patients are informed to schedule an appointment with a provider treating their diabetes every 3 to 6 months. This will ensure that the diabetes is being managed correctly. A hemoglobin A1C should be checked by the provider during these visits. An A1C is 3 months of their blood glucose put into one number. Increased exercise is a must. This will lower blood glucose, promote weight loss, improve blood flow, and increase energy levels. Modifying a diet. Patients are encouraged to eat more healthy fats, more lean protein, incorporate complex carbohydrates, and non-starchy vegetables. Patients are encouraged to check their blood sugar regularly. They need to either check before meals or 2 hours after a meal or as needed. Patients must take their medication as prescribed. If there are any side effects, they must inform their treating provider. They need to also see a podiatrist regularly as well. Foot care is very important for diabetics. That concludes my case study. Have a good day.